Did you know that a simple, inexpensive nutrient could dramatically change how your body fights infections and even boost the effectiveness of cancer treatments? Stay tuned to find out why this might be the most important health discovery of the year. Today, we are talking about vitamin D, often referred to as a vitamin, but in reality, it is a hormone. Unlike true vitamins, which the body cannot produce and must obtain from food, vitamin D is synthesized by the skin when exposed to sunlight. Once in the body, it undergoes two activation steps, in the liver and kidneys, before becoming a hormone called calcitriol. This hormone regulates numerous functions, including calcium absorption, immune system modulation, and cellular repair. So why do we call it a vitamin? Historically, when vitamin D was first discovered in the early 20th century, researchers classified it as a vitamin because they observed its deficiency caused rickets, a bone disease, and thought it had to come from diet. Over time, scientists learned about the body's ability to produce it, but the term vitamin D had already become commonplace. Despite its hormonal nature, the name persists because it's easier to associate with supplementation and nutritional health. With that clarification in mind, we'll explore groundbreaking research published in September 2024 titled Vitamin D, a Key Player in COVID-19 Immunity and Lessons from the Pandemic to Combat Immune-Evasive Variants. This paper sheds light on how vitamin D not only impacts COVID-19, but also plays a crucial role in boosting overall immunity. Let's break down what this study means for you. The information provided in this video is for educational purposes only, and does not constitute medical advice or diagnosis. Users should consult a medical professional or healthcare provider for medical advice, diagnoses, or treatment. Engaging with the content is done at the user's own risk, and accessing this content does not create a doctor-patient relationship between the user and the content creator. In case of a medical emergency, users should seek immediate medical assistance. The content makes no representations or warranties about the accuracy, completeness, or reliability of the information provided. Have you ever wondered why some people get severely ill while others barely feel a sniffle? The answer might lie in their vitamin D levels. The article highlights that vitamin D is essential for a robust immune response. It shows that sufficient vitamin D levels help the body fight infections like COVID-19 by regulating the immune system. This means fewer hospitalizations and a lower risk of severe symptoms for those with adequate vitamin D. More than 1 billion people worldwide are vitamin D deficient. Could this be a hidden health crisis? Despite its importance, many people lack sufficient vitamin D. This deficiency increases the risk of severe infections, inflammation, and even higher mortality rates. Alarmingly, most healthcare systems do not routinely test or supplement vitamin D levels, leaving a critical gap in preventive care. Think of vitamin D as the engine oil of your immune system. It keeps everything running smoothly. Vitamin D acts as a modulator, ensuring your immune system responds appropriately. It helps prevent underactive immunity, which allows infections to spread, and overactive immunity, which causes damaging inflammation, such as cytokine storms. What if your body couldn't use vitamin D effectively, no matter how much you had? For some, this is reality. The research explores genetic variations in vitamin D receptor genes. People with less effective receptors have poorer health outcomes, especially when fighting infections like COVID-19. For them, maintaining higher vitamin D levels becomes even more critical. Can vitamin D make your medications work better? For many patients, the answer is yes. The study reveals that adequate vitamin D levels enhance the effectiveness of antiviral drugs and cancer treatments. It doesn't replace these therapies, but ensures they work at their best. For example, patients with sufficient vitamin D respond better to chemotherapy and new antiviral drugs. What if there were a way to make vitamin D work instantly? Good news, there is. The article discusses the activated form of vitamin D, known as calcitriol, which works immediately compared to standard vitamin D supplements that require days or weeks to activate in the body. This could be a game changer in acute infections or emergencies. Want to protect yourself starting today? Here's what you need to know about vitamin D. First, make sure your doctor tests your vitamin D level to find out where you are today with the 25-hydroxy vitamin D test. It is the most accurate way to assess vitamin D levels and determine the total amount of vitamin D in the body, including both vitamin D2 from plant sources and supplements, and vitamin D3 from sunlight exposure and animal-based sources. The researchers recommend daily vitamin D supplementation, especially for those at high risk of deficiency. For most adults, a maintenance dose of 5,000 IU per day is suggested. However, individuals with low levels of vitamin D and in high-risk groups might take 50,000 IU once a week for 8 weeks, and then fall back to a daily dose of just 2,000 IU to maintain a good serum vitamin D level. For children, they recommend 400 to 600 IU per day depending on age. The results of the 25-hydroxy-vitamin D test are typically reported in nanograms per milliliter, (ng/ml), or nanomoles per liter, (nmol), depending on the measurement system used. Levels below 20 ng/ml, 50 nmol, indicate a vitamin D deficiency that needs correcting. Levels between 20-30 ng/ml, 50-75 nmol suggest a moderate insufficiency that probably needs supplementation. Levels between 30-60 ng/ml, 75-150 nmol are considered optimal by most health professionals. However, newer research is now causing many health professionals to recommend a value between 70 and 90 for optimal health. What if the answer to better health is as simple as stepping into the sun or taking a vitamin D supplement? Thank you for watching. This research highlights how a small change like maintaining healthy vitamin D levels could transform lives worldwide. Don't forget to consult your doctor before starting supplements. If you found this video helpful, hit like, subscribe, and share this information with someone who needs it. Together, we can make a difference in health and well-being. Subscribe to stay informed about the latest health breakthroughs. Let's keep learning and thriving together.